Now on GMA with our cover story, as of course we all know, October is Breast Cancer Awareness Month, and there has been an alarming rise in the number of women under 50 diagnosed with breast cancer in the U.S. So here to help us understand what's going on and what women can do is board-certified OBGYN Dr. Corinne Menn. Thank you so much for being here, Dr. Menn. Why are these numbers, why are we seeing them going up?
Well, first of all, I want everyone to know that young women can and do get breast cancer. I'm living proof. I was diagnosed at just 28 years old, and it's actually the most common cancer in women under the age of 40. And yes, the rates are going up at an alarming rate. We know that women under the age of 50, the rate's increasing by 1.4% annually, and in the youngest women in their 20s, the rate's going up by 2.2% annually. And young women have unique challenges. They're diagnosed often at a later stage, a more aggressive cancer, and their diagnosis is often delayed because of their age.
Now, another important thing to note here is while the numbers of people dying related to breast cancer are going down, we're still seeing some women impacted more than others.
Yes.
Why is that?
Well, there are racial disparities, and it's a really important point that women of color, in particular young black women under the age of 35, have double the rate of breast cancer that their white counterparts do. They're also much more likely to be diagnosed with more advanced disease and more aggressive breast cancer, like triple-negative breast cancer. They're less likely to be part of clinical trials, and really importantly, family history is important for everybody, but black women are far less likely to be referred to genetic testing based on family history.
Okay, so I check those boxes, and being completely transparent, this is something that is increasingly in the back of my mind. We were just talking off camera about the whole thing around dense breasts, and that can make it more difficult to detect, and women can just... How can we be more proactive about our health? What do we need to know about dense breasts? What questions should we be asking?
Yes, well, I think this is a siren call to all women, but especially young women. And I always tell patients, you really need to be the CEO of your own health and take charge. And some things that women don't realize is that 80% of women diagnosed with breast cancer actually don't have a family history. And 90% of breast cancers are not associated with a breast cancer gene. So, what can you do? Well, one, you have to stop the faucet on things you can control, because we can't control our genes, right? So that's like cleaning up your diet, lots of fruits and vegetables, a Mediterranean diet. And this isn't a popular thing to say, but really limit or eliminate alcohol use. It's a carcinogen. Get moving and exercise. Be a squeaky wheel. In terms of young women, 80% of them feel their breast lump themselves, right? So speak up, be aware of changes in your breast and report them to your doctor, right? Know your family history, not just on mom's side, but also on your dad's side, and see if you should be referred to genetic testing. There's really great breast risk assessment tools that take into account breast density.
There are the things out there, ask questions, all of that. We know for you, you said you were diagnosed at 28, that had to be so terrifying, but here you are now talking about it on TV, your post-breast cancer diagnosis daughter here watching.
She is.
Full circle moment. Thank you so much for being with us, Dr. Menn.
Thank you so much for having me.